guys, today I wanted to respond to a question from Abby about how do you respond when patients don't want to see a physician assistant? And this is a question that I don't get that often, but I think it's worth addressing. I'm Savannah. I'm the creator of the PA platform and the Pre-PA Club podcast, and I'm a PA. So I've been a dermatology PA for the past 5 years. I went to Augusta University and graduated in 2014, and I'm still at the job that I started at originally. So I see anywhere from 30 to 35 patients a day on a busy day. Sometimes it's a little bit slower and it's somewhere in the 20s. But that's a lot of people. And every once in a while, I get a patient who maybe isn't familiar with the PA profession or what a PA is or what we're capable of doing. So in my past 5 years, I was trying to think of some of the common questions I've gotten. So when are you going to med school? When are you going to become a real doctor? Can you do that? Can you do my biopsy? Can you prescribe medicine? What can you do? What did you go to school for? Am I seeing the doctor today? Is the doctor coming in after you? All of these questions can sometimes come up. And the way my office works is I have a medical assistant who goes to get the patient and takes them back to a room. She gets their HPI, history, asks a bunch of questions, and then she tells them, Savannah will be here to see you in a minute. Every once in a while, she's met with, who's Savannah? Or is that the doctor? And so she does get to kind of field them a little bit and say, no, Savannah's our PA. She works with the doctor. And that gives me a little bit of a heads up if I'm going into a room that may not be prepped to see a PA or know that they were with me. Now, our patients should be fully aware of who they're scheduled with. So our schedulers are great about letting them know you're seeing the PA, you're being scheduled with the PA. They get a text or an email that says you're scheduled with Savannah, our PA. And so it's not a surprise, or it shouldn't be, if they've been paying attention. So here's my response. And this is a question that can come up during PA school interviews or during interviews for PA jobs. How are you going to respond when a patient doesn't want to see you? And it's something that if you are entering the PA field and you're going to work as a PA, you need to be okay with this. You need to have a response and be ready to accept that some patients are going to refuse to see you. And that's okay. It's the patient's prerogative. It's their choice who they see as their provider. They're probably missing out because I'm sure you're great, but at the end of the day, you can't force them to see you or to see anyone really. So when I'm faced with this, my response is to not be offended. It doesn't offend me at all. If a patient doesn't want to see me because I'm a PA, I probably don't want to see them either. That sometimes is an indicator that a patient's going to be a little bit difficult, or maybe they've had a bad experience in the past. There's a saying that if a patient sees a bad doctor, they'll get a different doctor. If a patient sees a bad PA, they'll never see a PA again. Because a lot of times they've never seen one before. It may be their first encounter. And so if that first encounter isn't pleasant, it puts a bad taste in their mouth and doesn't show them kind of what our profession amounts to and what makes most PAs really great. You can't help that. You can't help what another PA does or doesn't do or how that's perceived by a patient. I think just as providers, we all make mistakes. We all have different personalities that may not always get along with a patient's personality. And that goes for doctors, nurses, PAs, NPs, everyone. So you can't help that, but you've got to know that it's going to happen and kind of accept it. So I don't get offended. I view those scenarios as a chance to educate my patients. And, again, as someone in the PA field, you need to know what your job is and what you're capable of doing. So if I meet someone or a patient who has some questions about what PAs are and what we can do, I try to answer those completely and give a little background on our profession and then what I'm able to do and on myself and my education. So for me, A PA is a advanced practice provider who's able to work with a physician, not directly at all times, but has trained with a physician in a medical model to provide care to patients. So we're able to see patients, take histories, do physical exams, order labs, order imaging, interpret those, and kind of look at the results, prescribe medicines and do procedures and come up with treatment plans. So really, PAs can do a lot of what physicians can do. And in my field in dermatology, I do very similar things to what the doctor does. She definitely handles some of our more intense surgeries, things that I don't want to do, patients who have a lot going on, a lot of really intense skin stuff, but I get some tough patients too. And I feel after 5 years in the field very qualified to take care of most skin things. That doesn't mean that I don't ask questions, because I do. If I ever have a question, I go to my physician and ask her. And we have a really great relationship where we can kind of bounce things off each other. We're constantly reading, constantly going to conferences and trying to learn more. So we're able to share that knowledge amongst all of the providers in our practice. But I try to educate those patients. I answer their questions and try to make them feel more comfortable. And if they don't want to see me, there's some choices. They can see me that day. So we all have busy schedules. And my patients know, or should know, and I try to let them know that they are welcome to see the doctor. It just may not be that day. So if they were put on my schedule, she may not have room in her schedule. And so they may have to reschedule with her, or we'll make sure that their next appointment is set up with her. I try to remind them to check their appointment reminders, and if they have a preference on who they see and see that that's not with who they thought it was, to call our office, because sometimes scheduling errors can occur. And then, I also just want to try to make them feel confident in what I do. And sometimes I'll tell patients, you don't want me to get the doctor. If I have to go get the doctor, it means you have something going on that I can't figure out, and that's not really a good thing. So a lot of times if I do have to get her and she comes in, it's funny because we say the same thing. I was trained by her, and so we have a lot of the same phrases, the same mannerisms when it comes to what we do. And it's funny because patients have commented on that, and they'll say, that's what she said, or you just did what she did, and she asked me about that. That always makes me feel better, and I think that gives confidence to the patients. It's really important as a PA that you have a relationship with your supervising physician where you feel supported and that they're not going to put you down in front of a patient. I've certainly been wrong before. I go out, tell her what I think is going on. She comes in, thinks something completely different, but she doesn't put me down in front of that patient. She just very kindly kind of tells them what she thinks is going on. We talk about it a little bit and then make sure we're on the same page. That usually doesn't happen. A lot of times we are thinking the same, but when it does, she's never going to degrade me in front of a patient, because that will make a patient's opinion of PAs in general go down. And I think just being in a practice that's pretty big with a lot of providers, I've seen how different personalities kind of interact, but also how much we can learn from each other. And I think that's so important. But back to the topic. So make sure if you're in that situation that you use it to educate your patients as much as possible and let them know first what a PA is, what you're capable of, and then also what their choices are as a patient, and that if they want to see a physician in the future, that is perfectly fine. And then as a PA, just understand that this is going to happen. Will it ever change? Maybe, but I think with the PA profession being somewhat newer, this is something that we're going to run into for a while. There's a big push right now to change our name, which honestly I don't think I'm in favor of, because I think it's going to be more confusing to patients. I may get some backlash on that, but I think at the end of the day, for me, it's up to me to show my patient what I'm able to do to take good care of them and earn their respect despite what my name is. And I honestly like that my patients call me Savannah. I'm okay not being called a doctor. If you're trying to decide, if you want to pursue the PA profession, that may be something to think about, because as a PA, you're going to have to explain what you do. Everyone knows what a doctor is. Everyone knows what a doctor does, but not everyone understands the PA profession. To be honest, even my own husband didn't understand it until he was working with PAs on rotations as a medical student. So it's normal, it's okay, and I think just the more we educate the public, the general public, our patients, the general population, about what PAs can do, the more that they're going to feel comfortable seeing us as providers and really just kind of wanting to see PAs in the future. So I hope that answers Abby's question. And if anyone else has a question, feel free to leave it in the comments or send us a voicemail and we'll make sure it gets answered. Thanks so much for following along. Make sure you're subscribed if you haven't already. And I look forward to talking to you later. Bye.